This is the very first study of a low-income housing rehab job that actually looked at health consequences of the rehab. So there have been some other studies of new construction for asthmatic children, but this is really the nation's first study to look at health before the rehab was done and then compare it to health after the rehab was done. Children grow up in these homes, their health will be impacted not only for the immediate future, but for their lifetime. So for example, the fact that we've been able to eliminate mold problems. We know that mold has long-term health consequences. We know that asthma causes declines in school performance. If kids don't do as well in school, they won't have as good a job, they won't be able to contribute to society as fully as they ought to, and over their working lifetimes, they will actually earn less. So these health improvements will last for a lifetime. All of these will have long-lasting consequences, frankly, not only for the people who live in this particular housing development, but for the nation as we try to integrate some of these concepts, which in a certain level seems like common sense, but integrate them fully into the way in which we educate our population as well as house them. I think the public health community is now realizing that housing matters. It's not just an economic problem for the nation, it's also a very key component of how our population's health is going to be affected. It makes no sense to be able to find the financing to put people into homes and then have them pay for a huge medical expense if the homes are not healthy. So there's a lot of numbers that we can put out, but I think the bottom line is clear, and that is that when you make these kinds of investments in housing, you can have demonstrable real benefits that are measurable for both children and adults living in the units.
Since I moved to biking terrace, no one sick in my family. Or everybody healthy now. No worry. I'm okay with my life right now because I don't see my kids sick. When you live in a very good area, a very good house, you get healthy.